Thank you so much, Lindsay. Thanks, Lindsay, and thanks everyone for joining. Good afternoon. Just briefly about me, just so that we can get started. I am Tina Ann Thompson. I'm a family physician here at Emory, and I lead our primary care division. We are here today to talk about stress. And the first thing is that I am a good researcher, but I am not the expert. A little bit about me and who I am. First, I am a mom. First, I became a wife. My children are now 19 and 17, and I have been practicing in Stone Mountain for about 18 years plus now. It has been an absolute joy of my life to practice medicine. I have loved every single minute of it. And like all of you, I am sure the pandemic has drastically changed the way that we do business and the way that I do my work and see my work. So I have had to really dig deep and make sure that I do a lot more self-care than I ever have so that I can actually bring my best self to my patients and my colleagues and our staff. So I'm going to share my screen. But the first thing that I want to make sure that we do today is I rarely speak to a screen. I always speak to people. And so if there are any questions, please feel free to interrupt. I will try to make this as interactive as we can in a webinar type of setting. So please use the chat, use the Q&A. I will try to have you folks weigh in on some of the discussion topics that I have today in my presentation. So I believe I am sharing my screen, and it should say stress does not equal health, and then just my tagline. So the first thing that we always talk about, I'm an educator too, is what is stress? And stress, typically external stimuli like troubling situations. And the body's physiological response to a troubling situation is the part that I'm going to talk most about today. It's also a transactional response to a troubling situation. So these are just the three definitions of stress. Again, I will be talking more about the second, which is our body's physiological, and I just want to stress that, response to a troubling situation. So who's at risk of stressful situations and the body's physiological response to stress? There are certain personality types that lend themselves to both being stressed and then having physical responses. And this describes a lot of us in healthcare and in education and in administration. And these are the folks who are anxious. These folks are anxious and reactive. Often they overreact to fearful, frustrating experiences. These folks are likely to experience more stress. The folks who just worry a lot. They are really worried about the next thing that might happen. And sometimes the next bad thing does happen, but they overly worry about it. A lot of us think about our grandmothers always worrying. I'll put myself back in there, and so it's my grandmothers who were constantly worrying. The coronary prone personality. So these are the folks who, coronary heart, these are the type A folks, the folks who are constantly racing against the clock. These folks tend to need a lot of power. They don't really have a lot of relationships. They just move fast, right? So you're in the hallway walking with them and you hear them clicking behind you with their footsteps, and you realize you need to move out of the way because they're coming and they're going to be terribly annoyed at whatever pace that you're moving at. These folks don't really do well relaxing. So they go to the beach, they are wanting to do something constantly and not just resting and listening to the water. They're the folks who are constantly needing to move and do something. They often just, again, they tend to be competitive. They tend to just sort of dominate conversations. And again, these folks are none of these personality types are necessarily bad. These are just the folks who are at risk. I just want to make it clear. Anxiety sometimes helps us to achieve the things that we need to achieve. If we didn't get anxious about the test, we might not study for it. It's just a matter of making sure that we put into perspective the fact that these folks tend to be more at risk of physiological responses to stress. So how do we recognize stress? When we go to the doctor now, if we're 12 and up, a couple of the questions that are asked in our office visits are, have you felt depressed or in the last couple of weeks, or have you not wanted to do certain things? And there are variations of the way that we phrase it. We're supposed to phrase it exactly the same way. But if you're 12 and up, these questions will be asked. A lot of folks will answer, no, I'm fine, and not really recognizing the fact that they're stressed. And this is something that comes out for me as a clinician in the office visits. It doesn't happen right away. How are you doing today? I'm doing fine, doc. And then we dig in a little bit and we see that there's some signs that we might be having of stress. And so just recognizing these signs are important so that we, again, can bring our best selves, making sure that we know when to pull back and say, hey, wait, I'm stressed. Some of these things are like behavioral changes. And so these are things that I also look for in my adolescents who I treat and the people in my house. Behavioral changes, they start to get more aggressive than usual, or they start to avoid, right? So your teenager, your spouse, your best friend, your partner just starts to be more avoidant. Then there's some physical symptoms, like just a hyper arousal. You know, you walk into someone's room and they're jumping. They're just constantly in a state of like hyper arousal. Sometimes the physical symptoms that I see in medicine are slow digestion. So we sometimes call this irritable bowel. Just because you have irritable bowel does not mean you're stressed, but it is one of the signs that can occur under stress. The other thing is an increased heart rate. Yes, sometimes this can be a problem medically, and stress, we do believe, is a medical condition, but there are times that the increased heart rate does happen, not just because we had too much coffee, but because our bodies are preparing for whatever it is that they are going to be aroused by. The other one, and hopefully no one on this call has this, I will be guilty of this one, blood pressure elevation. Sometimes it's genetic, but sometimes if we are nervous about something, we will see the blood pressures start to rise. And then once we start to calm down, we can see the blood pressure start to go down. You know, cognition is one of the ones that I see a lot in healthcare and medicine. One of the things that folks will come in and say to me is, Doc, I cannot focus. I absolutely must have attention deficit disorder because I can't keep anything straight. And often this sort of disorganization of thought is because we're under so much stress that it is hard to prioritize and use all of the tools that we have used all of our lives to stay organized, to take the SATs and all of that. All of a sudden, we can't put stuff together. The bill is late and you forgot to pay the mortgage or something, like you're just dropping balls everywhere. Oftentimes, this is a reaction to stress and not necessarily a full-on diagnosis of attention deficit. So this is where if you got on the call right on time, because we asked this question for those folks who are a little bit early, what are some of the causes of your stress? And so a couple people put in just the insurmountable work. I know that has definitely happened in, again, the healthcare education space, aviation space, customer service. Just a lot of us have been asked and needing to work far more than we ever have before, post-pandemic. And so the causes of stress also, for someone put in, just not being organized and things sort of being out of order and chaotic, that also can cause some stress. Some of the environmental stresses, and I know a lot of us now talk about the social determinants of health. We find that the environment is actually sometimes a significant cause of stress, whether it's overcrowding, not feeling safe, tremendous amounts of noise, areas being dirty, and not able to have a clean space to exist in. Those things we know cause stress, and we know they have significant effects on health. Employment, boredom. I wish I could be bored sometimes. It just has not happened in the last several years. But sometimes, just being bored at the job actually can be signs of stress. Deadlines for a lot of people, self-imposed and employer-imposed. And then, again, insurmountable volume of work for employment. Also, sometimes not being around the people that we want to be around, that can sometimes cause some stress. And then there's some emotional pressures. Just the people, again, going back to the personality types, those folks who are real perfectionists. A lot of high performers tend to be perfectionists. It happens. We were told to get good grades, and we did, checked that box, went to school, checked that box, go to vocation school, and we try very hard to be the best human that we can possibly be. And then we start comparing ourselves, because that's what society does for us. It ranks us even in school. You get a ranking, and we compare ourselves to the people next to us, not realizing that life is not as it appears on Facebook, Instagram, and TikTok. Those things are not real. Those are like little reels of time that folks choose to look. If you look at my Facebook page, it looks like my children always win their soccer or track meet. And we are always on vacation, and I am always walking 7 days a week at sunset or sunrise and taking pictures while I hike at Stone Mountain. That happens every single day. It doesn't, but if you look at my social media, it would appear that that is who I am every single day. So another person just put in just family pressures, right? So, and that is very common for a cause of stress, is just helping somebody else with their stress, and feeding off of the other person's stress. Those things are very common, and things that we talk about in medicine with our students and our interns all the time. If you walk into an exam room and you feel stressed, and you weren't stressed before, oftentimes that's what's going on in the exam room. Embrace it, realize it, and know that something is probably going on with your patient, with your student, with your colleague. If you're walking in the room and you're just feeling burdened by something, it might not just be you, it might be the person around you. And again, we're humans that are designed to be around other humans. And so when we feel things, let's not feel too much that we are overwhelmed by it, but let's understand that those feelings are not just always about us. So this is my job every day, all day. I see the results of stress, and that's why I talk about this, because we have to do something, and we have to talk about it, and we absolutely need to recognize it. So some of these things, again, on the screen, are things that could have happened because of our genetics, because we're predisposed for it, because we have taken a medication that causes something, that has a side effect that causes it. or various other things. But one of the things that I will tell folks is that no matter what the illness, stress makes it worse, no matter what. So if the person has chronic pain syndrome from whatever it is, fibromyalgia, chronic pain from arthritis, any of those things, the stress levels will make the perception of the pain worse. So it's not just, fibromyalgia is because of stress. No, it's the stress makes the pain from the fibromyalgia worse. Same thing with the arthritis. We can find that inflammation in the body really is heightened when we're stressed. Ulcers, that's a classic one. Overstressing, not eating, drinking a little too much, taking a medicine because we were in pain, those things can create ulcers. I already talked about irritable bowel syndrome, maybe oversharing here, but my body reacts very differently to stress. It doesn't hold it in, it just lets it all out. So the SATs, like complete ball of complete nerves. I still remember it. It was now 30 plus years ago, and I remember just the noises that my tummy was making while I was taking those SATs. And so irritable bowels will definitely be worse because of stress. I already talked about high blood pressure. Folks, we've got to figure out how not to allow our blood pressures to go up so much because of stress. And then not sleeping, waking up and thinking constantly about what it is that happened the day before, what we need to do, making that mental list. Those things are, again, very classic. Again, insomnia, super, super common with stress. The list is long. And that's why I made it 2 slides, just so that you all could see that there are so many things. And I won't go through each and every one of these, but when we start to gain weight because we are just so stressed that we're eating, and then that just cascades into stress eating, then stress diabetes, then stress cholesterol, and then we're taking a medicine, and then we're just on this hamster wheel of not being healthy because of the inciting event, which was not managing the stress. A lot of this stuff we know a lot about, and then we'll hopefully get into how we all handle our stress and how we manage it. Dermatitis. This is one that I talk about quite often because the skin actually stresses as well. And, seriously, folks, let's look at the before pictures of our presidents, which is probably one of the most stressful jobs in the universe. And then look at their afters. I think about how our bodies react to stress, and these folks have all of the cooks and the makeup artists and the hair people in the world, and they still end up aging tremendously after their terms. So yes, our skin absolutely stresses as well. And this is just a picture of, I'm in the middle, my daughter who's 19 is on one side, and my mom who's 80 is on the other side. And we stress as well, and we are all trying very desperately to not allow our stressors to age us. And again, the skin does age, right? Like you can see super, super tight, high cheeks here. And then over time, the cheeks do start to settle. And my mom is absolutely gorgeous, and she doesn't mind that I share her picture. But the cheeks do fall, and this is what typically happens. And this is just, again, this is 80 years, but this could have happened much, much sooner if under just a tremendous amount of stress. So again, I talk about the skin because it's so important to a lot of us. And some of the things that we'll see with how the skin ages is folks who pull out their hair, lots of acne, alopecia areata. I know alopecia has got a lot of press lately, but again, a lot of folks will see worsening of their alopecia, meaning their hair falling out when they have a lot of stress. Again, atopic dermatitis with the scratching of our skin, that can absolutely happen worse with stress. We've seen this, right, where folks have just scratched their skin to a leathery texture just from being stressed, because it is so relaxing to just scratch and pick at the sore. It can be a source of, it can be a manifestation that something else is probably going on. So whenever I see someone who's constant, who I can see their skin and their skin is picked up on, I think, I wonder what's going on underlying. Let me not just treat with a cream. Let's figure out what's making the patient scratch this thing. So this is where, again, I want to see if anyone either wants to come off mute or put in the chat, like, what is it that you do to help yourself not to help yourself to get through the stressors, because we're going to have stress, right? It's gonna happen. What I wanted to talk about today was, how does our body react to it? One, and two, how do we actually get through some of the stress and come out on the other side so that we can be our best selves? So one of the things that I like to talk about is just figuring out our life's purpose, our mission, our vision. Like, why do we get up out of bed? It's raining today if you're in Atlanta. It's raining and you still get up and you still get out there, even if it's just on Zoom, and you try to figure out whatever it is that your life's purpose is, whether it's to help people or to make the world a better place than when you got here, or to just get through the day. What is that life purpose? And so really trying to clarify it, writing it down in just a statement. This is something that we were asked to do when I was an intern, and I came home, told my husband, and I said, babe, we got to write down exactly what our family mission statement is going to be. We'd been married for a few weeks, so he gave me, he said, okay. Now I probably couldn't get that out of him, but we wrote it down. What is our mission? So we want to just figure that out, if at all possible. Until we figure it out, folks, sometimes we just have to sort of use somebody else's. Pick a quote out of a book, and then just see, maybe that'll work for a little while. I understand that a lot of us are still seeking, though, but really trying to seek out that purpose based on what we our gifts and our values are. And then we've got to develop the vision, right? Like, how are we going to carry out this mission? So I was given the mission to be a part of folks' lives and just let me in and see what I can do to help them at various stages of their lives. That's what I try to do every day. So how am I going to get that done? I'm going to get up, I'm going to go to work, I'm going to research, I'm going to figure out how I can help folks. Thank you to someone who said my mom is beautiful. And then taking a walk is what someone else said, and then meditating and praying and breathing. Yes.
So, good afternoon, everybody.
Good afternoon.
I enjoy taking those long strolls and walks around Stone Mountain, because that's where I pretty much am able to diffuse a lot of the environmental stressors and the work stressors and the stressors from, just being a mom. And well, now I'm a widow, but at the time being a husband and wife team, trying to make things happen for the children. Going around that mountain helps to put things in perspective. And that's pretty much it. I write as well. So I do a lot of journaling, and that is like an immediate type removal of stress. I saw what you said about the type A personality. I guess I'm a A- personality, but I'm learning now about meditation, and I do pray a lot. So the meditation part, I'm getting ready to work on incorporating in my de-stressor methodology. So this is a good course. Thank you.
Thank you for that. Speaking of meditation and prayer, one of the things that I was told that someone does is before her coaching meetings or mentoring meetings or anything where we don't have to just jump right in, she starts with a minute, 60 whole seconds of silence. And sometimes you can't say pray, it's at work, you can't say meditation or whatever. So it's just a minute of silence, just to center everyone, just to, like, if it's your one-on-one check-in with your one-up or the person who you supervise, a minute, just to get everybody in the right space. So I love that meditation idea.
Good deal. And I like what you just gave. I'm going to try that. Definitely. That's perfect. Thank you.
Thank you. And I'll see you at the mountain.
Yes.
So time management. Now this one is absolutely key. So our type A minuses, they often will do this pretty well. Our A minuses are the folks who write it on the index card, the Palm Pilot, if you're my age, or a calendar. I carry around a book, and so whatever it is that gets you scheduled is very helpful. And then we have to prioritize, folks. We can't be everything to everyone all the time, every single day, right? So we have to prioritize. And I understand that we can't always put ourselves first, because I get it. I'm human. I live on this earth. But we have to do it sometimes. There are times that we have to say, you know what? I need to take care of me. And just this one moment, I need to take care of me. And if it's just for the minute, 5 minutes, 10 minutes, whatever it is, we need to take care of ourselves. And then schedule things, schedule fun things, schedule meditation, schedule prayer. Sometimes we have to do that. Schedule the walk, schedule time to figure out what it is that brings you joy. That's important too, just as much as it is to get those bills done. And then delegating. This one is tough for some, and easier for others. But if there's something that you don't have to do, then don't do it. Empower somebody to be able to do that for you. Somebody else might want to lead the meeting. You never know. You could ask and just see. So sometimes it's empowering to have somebody else to do something for you. I will try to delegate as many things as possible. There have been years in my life that really cooking just was not going to happen. I would buy so many chopped up vegetables. They were already done for me, so that all I had to do was just cook them. My mom, love her to pieces. She helps me with my cooking. She helps me with seasoning my food so that I just have to cook it. I know I'm spoiled, but whatever it is that we can delegate, so important. One of my friends, she has someone to do her laundry. It's a college student that she has helped to not actually wash the clothes, but fold them and put them away. She feels like she's helping this college student because you have to give back to society, and she's getting her laundry put away. Whatever it is that doesn't need your absolute personal attention, please do try to delegate that. Zen meditation music, love that. Yes. And then there's just managing the lifestyle, right? So we talked about those type A's, those type A minuses, the perfectionists. It's so important to embrace ourselves and know who we are and accept ourselves, and to have that positive self-esteem. What we can't do, though, is allow our personality traits to take over and cause us any stress. So, again, I put the capital H for we are created in someone's image. I believe it's God's image. And so we have been created to be valuable, right? I tell everyone that this is a temple that I have been given. And so I'm not going to just put garbage in it. And I'm not going to let anyone do anything to it, because it's a temple. So you're not going to come over here and abuse me. You're not going to yell at me. You're not going to hit me, because this is a temple that I have been given. And that is how I try to teach my students. I'm going to try to teach my young patients, my adolescent patients, my older patients, and try to teach my children. Like, this is not meant to be harmed, not by me or anyone else. And so it's so important to make sure that we have that positive self-esteem, so that when things come our way, we can block and tackle and say, not today. You are not going to affect the temple today. So our social support, this is important. We used to call it an accountability partner back in Sunday school, because you had to have an accountability partner so you'd be a good girl. Whether it's a confidant or a spouse, it has to be someone. And it's not always the same person for every situation. There are times I'll start chattering with my husband. He's like, can't you call your cousin? Because he doesn't want to hear it that minute, right? So sometimes it's not always the same person all the time. Sometimes it's going to be a girlfriend for this, or a boyfriend for that, or mom for this one. But definitely having that social support is super, super helpful. This is how my little one copes with stress. He's now 17, and clearly I need a new picture, but he's just not as cute anymore. So exercise is the one that we just talked about, and that's so important. This is the other thing that sometimes we have to do, right? We got to laugh it off sometimes. No, it's not always appropriate in either of our lines of work to laugh at certain things, but it is, I've been listening to some TED Talks. It is a sign of emotional maturity to just be able to laugh at some things. Everything cannot be always that serious. It also increases endorphins, and it's better for your face, so that you can stay looking as young as possible. It's so, so, so important to laugh. So if it's a Mad Libs that you do, or you watch something silly on television, or someone tells you something and there's a dad joke, those are the new things. It's so important to laugh. And then, we can't take everything too seriously. Sometimes there's an off comment that is totally inappropriate, and yes, HR needs to be involved, and no, we should not have a sense of humor about it. And so there are boundaries to that. But really, guys, it's so important that we just take a pause sometimes and just laugh at something. And then this is my favorite, having an assertive a response. Again, I just told you all about the temple. No one comes in here and abuses. Giving a straightforward response without the ums and the I thinks and the well maybes. Like, be clear. What do you want? And learn how to speak the truth. We don't have to be mean. That is not what I'm asking anyone to do, but it is important that we do assert ourselves and that we speak the truth whenever we're able to do that. A lot of times what I have to do is to have a difficult conversation with someone who has had some challenging behavior. Hopefully that never happens to any of you. And I have to, it can be a stressful event, but when I learned how to speak the truth with kindness and with love and with empathy, I was able to accomplish those things and accomplish those conversations with a little bit less of the hormones that are released during stress. So this is where I come in. I'm a doctor. At the end of the day, I always want to talk about the doctory stuff. When do we ask for help? When is it not just enough to call mom, girlfriend, spouse, dad, and when do we think that it is important to reach out to our primary care provider? Hopefully you all have one, or a therapist, or the school guidance counselor, or someone. If you can't, sometimes we can't even get that far, but how do we ask someone to get us some help? When the feelings are out of control, right? When you just are, some people will say, losing your mind, like you cannot think straight. And it just seems like you cannot figure out how to move forward. And you can't figure out, like, if you're going to make good decisions. Again, just really out of control, not knowing where you are, so important to get some help. If there's chest pain, it's not always heartburn. Your heart's beating fast and we're short of breath. It could be stress, but it also could be something medical. And it's really important that at the very least, the first time it happens, we definitely need to get that evaluated by a medical professional. Sometimes, remember I talked about pain, chronic pain, I said about fibromyalgia and all of that. We can't just, again, like, oh, my neck is hurting because I'm stressed. No. Or I have a migraine because I'm stressed. That needs to be evaluated by someone. Let's do the workup. And then when we don't find anything, then we can say that it is likely a stress-related illness. And then be your own advocate. Trust yourself. You have been in this body for, not sure who's on the call, but 17, 18, 20, 65, 70 years. You have been in this body, looking at it, touching it, talking to it for the last however many years. You know it really well. And if something doesn't feel right, you need to let the medical professional know something doesn't feel right. Something in my gut is not right. And there is help, lots of help. It's not always easily received and it's not always easily accessed, but there is help. So going to our primary care provider, starting with that person, if you have one, hopefully you do. Sometimes we have to do medications, right? If the exercise is not working and all of the things that we just said is not working, and you're still feeling that sense of dread and overwhelming doom, sometimes we need medicine. And that's okay, because medicines are they're not giving up. It doesn't mean that the prayer, the meditation, all of that has failed. That is all in addition to. So there are anti-anxiety medicines, there are anti-depression medicines that just make the happy hormone serotonin stay around a little longer, so it just sort of sticks around, so you get a little bit more than you maybe either were born with or that you have. Sometimes it's just necessary to do that. Sometimes we have to find the right one. So just because something maybe didn't work, 5, 10, 15, 20 years ago, does not mean that nothing else will ever work. There are side effects, but they're not always that bad, right? And so sometimes the side effects go away within a couple of weeks, and most folks, after they've been on it for a little while, they'll say, why didn't I start it sooner? Like, I feel so much better. Like, at least I don't feel this overwhelming sense of doom, or I'm not so worried about the next bad thing that might happen. This doesn't solve all the problems, but it does take the edge off a little bit so that we're able to just move through the day a little bit easier, so that we're not walking through mud. That's what some people will tell me. Like I feel like I'm walking through mud. And so this just helps a little bit. I love chamomile tea and valerian root and melatonin and warm milk and a nice massage and the warm bath. But if you're not getting sleep and you realize it's been just years since you've had a good night's sleep and you're constantly waking up tired or whatever, sometimes we need a sleep study to figure out, make sure you're not having sleep apnea, like you're not snoring too badly. But other times we just need a sleep aid. There are some non-habit forming sleep aids that one can start. I don't love the habit forming ones. There is a time and place for most things, but I typically do not prescribe the habit forming ones, and I would recommend against those if at all possible. And then complementary medicine, I think we call it alternative medicine or functional medicine. We call it all kinds of things nowadays. I call it complementary medicine because as a person who has grown up in both the Caribbean and in the South, I realized that we have lots of ways that we will treat ourselves that don't involve a little white or pink pill. Acupuncture works great. I hate needles. I love acupuncture. It works magic. I really hate needles, except for the COVID vaccine and the flu shots. But acupuncture really does work. And healing hands. And if you've never experienced healing hands, this is just not just, it's a practice in which the hands are placed strategically on the body or near the body, and the energies are actually released, and folks just tend to feel less stressed. I don't know how to do it. I just know I've been on the receiving end of it, and how much better and how much more relaxed feeling afterwards. And so these are things that we need to do, right? These are things that we're going to learn in therapy, because that is crucial. So in addition to medicines, in addition to exercise, in addition to the music, we need to do some just cognitive restructuring. This is something that a therapist can help with. This is not a girlfriend moment or a boyfriend moment. This is something that a therapist who is trained for years will help you with, right? So they will help you with this positive mindset. They'll help you to just reframe the situations. That's what therapists do. It's not just going in and talking about my problems and, oh, I don't want to just talk about my problems. No. They are actually helping you reframe so that you can be in the same situation, because they're not going to stop the situation, but it will feel less stressful. Again, helping with problem solving and figuring out how to directly take action so that you can be a little less stressed. My personal one, practicing forgiveness. There's somebody that, every time they talk about it in church, you have to forgive. There was always one person on my list who I did not forgive. And a few years ago, I finally did. And it has been such a release that I have to always put this everywhere, is sometimes we just have to practice that forgiveness. I haven't forgotten. I just talked to you about it, but I have forgiven. And then just, again, dealing with some unresolved issues. This is, again, don't deal with this on your own. This is not wise. Get a therapist. Get somebody who knows how to do this work. They spent their careers learning how to do this. Let them help you to deal with some of these unresolved issues. That's all I have for you today. If there are any questions, please let me know. And I'm not sure if Lindsay has questions in the Q&A or if there are any others in the chat, but I will stop talking now.
Thank you so much, Dr. Thompson. A virtual round of applause. That was so insightful and so helpful. I don't see any questions coming through the Q&A right now, but everyone is more than welcome to use that. We still have a handful of minutes to spend together this afternoon. I've also given everybody the ability to mute or unmute themselves if they want to speak up. And we also have the chat feature as well. So I saw someone just said, will this information be available in print? Yes, we can share the slide deck as well, Dr. Thompson, if you're okay with that, as well as the recording afterwards. I don't see any direct questions coming through yet. I did have one question, I guess, that I know we've actually, myself and some colleagues kind of talked about as we were planning this presentation. In a lot of your different points that you made in terms of seeking help and talking to a professional and going to a therapist. I feel like as much progress as we've made in 2022, there's still unfortunately a lot of stigma around seeking help and seeking care for yourself when it comes to that type of stuff. And that maybe sometimes just making that initial step, that initial reach out is the biggest hurdle for people. Dr. Thompson, if you could just maybe kind of briefly describe for folks who might not be familiar, like what does a session with a therapist look like, or what does, scheduling a one-on-one with someone, like kind of a little bit, just describe a little bit into that mystery. So for people who may be wondering to get a little more insight.
Thank you for that. I I take care of a lot of parents and of adolescents who need to get therapy and help, and it's always fascinating to me how much we're able to help our loved one and get over the stigma for our loved one, our spouse, our parent, our child, but not for ourselves. And so I think, and I really do feel like talking about it more in on the news, in TV shows, on the Dr. Phil's of the world. I feel like we're finally getting to the point where we're saying yes and. I've even gone to some church services where they've said like, it is okay to get therapy. Like it's all yes and it's exercise and therapy is not cheap. And thank you for calling that out. There are some resources that I will use for my patients who have specific illnesses, right? Or not illnesses, specific causes of stress. One of them is Grief Share. So Grief Share is free. It's in a lot of our community centers and churches. And I usually share that one because that's an area that is timely. The grief has to be handled in a timely fashion. And so that one is one that is not too difficult to access. Again, a lot of churches around Atlanta do have Grief Share. The other one is Alcoholics Anonymous and Narcotics Anonymous for folks who struggle. That's not, again, not therapy, but it's a way to get some help. The other ways are with our places of employment and seeking out those either faculty or staff help. And I think that lots of places call it like employee health or things like that. But those are another source to get help. And the other one is on websites, right? So if you go on either like Psychology Today, they will actually have some information about therapists. But again, they will do a sliding scale for some. A lot of them no longer take insurance because the insurance industry has made it super challenging to get reimbursement. So a lot of folks are cash only. So I hear you in the fact that this is not super easy to access and it is not inexpensive. And your primary care provider is not necessarily a therapist, but is a really good start to just sort of figure out what resources that they may know about. Looks like we're talking about employee assistance. So that's the name of the program here. Employee assistance is available. Does stress have anything to do with habitual lateness for any event, whether job, pleasure, or church events? Yes. So that's what I was talking about, the disorganization, right? So sometimes when there's so much going on in our heads and we haven't figured out how to compartmentalize and to make sure that we are prioritizing things, we're just all over the place. And so we feel like we have attention deficit, but we don't. We really just are stressed and we need to figure out how to prioritize so that we can be on time, especially for the jobs or even pleasure. So yes, so important to make sure that we recognize and make sure stress is not part of that. And again, someone else mentioned EAP, and 6 free sessions are available for us. And a lot of employers do have that as a resource to get that help. And it is confidential. I will absolutely speak to that. I don't know specifically your organization, but these folks take their jobs really seriously and they're good at it. And it's so important to utilize whatever resources that we have here. What a typical session looks like is a lot of information gathering. There's a lot of not talking. My husband's actually a psychiatrist. He doesn't talk very much at all. There's a lot of the therapists just listening, but using guided questions, right? So it's not just tell me about yourself and tell me about what stresses you. It's really guided questions and helping you to, again, frame the situation that's happening and figuring and letting you figure out with homework, there's often homework, letting you figure out what it is that you want to work on so that you can, again, just put your best self forward and just enjoy life. A lot of self-reflection will be happening during this. They will not tell you what to do. I'm guilty occasionally of that, right? Someone comes to me, they say they have the problem. Oh, well, you just need to do this. Which I'm not a therapist, and I try to hold back when I think I have the right answer. But again, it is so important to go to a professional who actually knows how to get you to frame your situation so that you can just move forward, not through mud, but move forward a little bit more light.
And I know we still have a few minutes left here. So if anyone else has any other questions, comments, the floor is open, the chat is open. Just again, Dr. Thompson, thank you so much. This was really, really great. I hope everyone was able to learn something new out of this today. Like we said earlier, this has been recorded. This will be shared afterwards, as well as the slide deck. Just a little plug for our next event together for the school district will be in December, also on the 15th, so about 1 month from today, on hypertension, aka high blood pressure, and everything to know about that. So for all the folks still on, look forward to more information about that to be shared. I'll give folks, I guess, just another few seconds here to see if anything else comes through. And then we will wrap up. I did have, so just personally, I thought of one quote while you were talking, Dr. Thompson, in terms of, comparison and the social media world that is current day. One of my favorite quotes that I don't know where or who I heard it from, but that comparison is the thief of joy. And I really just try to resonate that with myself whenever I get in somewhat of a rabbit hole, feeling, like I'm comparing myself to everyone on the internet. So just wanted to share that.
I love that. That is great.
Yeah.
It truly is.
It looks like we had another question come in. Is compartmentalizing a good coping skill, or can it be unhealthy?
For most doctors, we're going to say it depends. Oftentimes, compartmentalizing is a defense mechanism, a coping skill that has to happen in the moment. It is very challenging for those of us who are human facing in the service industry to just take all of our stress on and then just go through the day. There are times that we just have to leave it in room 10 and move on to room 11. And same thing here, right? You've got to go from one meeting to the next. Sometimes it needs to be compartmentalized, but at some point, we've got to figure out how to handle it so that it is not overwhelming. So it's not the monkey that's sitting here constantly. It is something that it is, again, a lighter burden to carry. So great question. Thank you for that. Comparison is the thief of joy. Love it.
I know personally, and this is something I always go back and forth with, is I always say I can relax and de-stress better when my house is clean. But it's almost a catch-22 because then I stress myself out more trying to clean and get everything done. And it's like, if I just run this race faster, then I'll get to the end point. So it's always a work in progress to step back and take a breather and say, I can relax even if there's still dishes in the sink. It's going to be okay.
Yes, 1 minute. Don't forget that 1 minute. And someone raised their hand.
Yes, that was me. Thank you so much for the information, but I wanted to know the correlation between heart disease and stress.
Absolutely. So the hormones that are released when we're stressed are the same hormones that will that are released when you start to fight the bear, right? So if you think about why we have these hormones in the first place, it's because when you are about to undergo a huge task, you don't want to, you just need everything to be tightened up, right? You don't want to have any bodily functions happening. You want to tighten up. And when you tighten up, the blood pressure goes up. And when the blood pressure goes up, that eventually can lead to heart disease. Again, it also then contributes to overeating, which can lead to heart disease. So it leads up to it. And so we've seen it, people have what we call broken heart syndrome. So somebody has been under an extreme amount of stress, often the loss of someone close to them, and they actually will come into the emergency room with the enzymes that are released when one has a heart attack. And again, we call that the broken heart syndrome. It absolutely happens, and it is it's pretty scary when it happens, but we recognize it now as in the healthcare profession. Great question. Thank you.
Thank you.
Awesome. Well, it looks like we are at 2 o'clock. We will go ahead and wrap things up. Again, Dr. Thompson, thank you so much. It seems like a lot of folks really enjoyed this today. I know I did personally. And again, for everyone still on the call, we will be sharing this information. So just keep an eye out for that being shared with you all. And we look forward to seeing you all in December and hope you all enjoy the start of this quickly approaching holiday season.
Thanks,
All
everybody.
right. Thank you, everyone. Have a good one.